Okay, so this recording is about information gathering. And with information gathering, we're obviously looking to collect information. And in your pre-study day reading, we provide the full details of the content that you're looking for relating to the disease, ranging from the history of presenting complaint through to the systems inquiry. So as well as these disease and treatment related pieces of information, you're also looking to gather from the patient what their ideas are. So ideas related to possible diagnosis and ideas related to potential treatment options. You also want to capture any concerns that they might have, either about a possible diagnosis or treatment, because with this information you can either allay their concerns and say actually these concerns are unfounded, you don't need to worry about them, or when you are giving information and if they are valid concerns, you can present that information in an appropriate manner, bearing in mind that they are already have negative emotions about this, they're already worrying about it, so you know not to alarm them further. And then finally, you want to capture their expectations, both their expectations about the consultation. So remember, at the opening of the consultation, you provide details of your role and what to expect from the consultation, but also what you want to do is get an understanding of what they were hoping for, and therefore you can then address any sort of mismatch in what you can deliver with what they were hoping for. And also you're looking for some indication of what their expectations are in terms of a possible diagnosis and treatment, because again, if those expectations align with what you can deliver, that all is well, and if they don't, then you know in advance that you will need to address that in an appropriate, sensitive manner. So this is the whole package of information that you are looking to gather from the patient. So you kind of, in your brain, you have this as the core, and then you have the behaviours, so the tricks, the tools that will allow you to capture this information from the patient. And as you become more and more familiar with this process, you will find that you will be able to give almost 100% of your attention to the content, and establishing what you know, what you've already gathered and what's left to gather. And very little will you need to concern yourself about these tools, these behaviours, because they'll be second nature to you. Much like when one's driving a car, so in the early stages when one's learning, one's thinking, okay, am I in the right gear? What speed am I doing? Do I need to indicate now? And yet later, when we become proficient drivers, we can just take in the scenery. So as you become more familiar with these consultation behaviours, you will be able to focus on purely the content and where you are in terms of how much content you gathered, and not worry about the tools that you're using. So your key tools are the use of open questions, and then following those open questions up with silence to allow the patient to do your open question justice, so that they give an extended, deep response. If you ask a beautiful open question and then you follow it up quite rapidly with another question, then actually you're not doing your question justice, because you're not going to get that extended response. And what you're really, as an indicator of whether or not you've got the balance right, you're looking at about 60 seconds, so a golden minute, 60 seconds of the patient talking, that opening part of the consultation. And then we talk about this open to closed cone because we're using primarily open questions and silence. But then when we've got the vast majority of what we're looking for in a specific area, I mean, we would then, rather than going around the houses and asking more and more open questions to try and get the patient to second guess what we're looking for, we will just ask a few closed questions just to close that loop and then move on to the next topic. In addition to using silence, What we also have, what we want to avoid non-verbal utterances, so things like avoid those early on, because what that will do is that will encourage the patient to actually stop talking and hand over to you. So you really want silence, and what you can use is your body language. You can use your hands, you lean in, you can nod encouragingly, so inviting them to give you more and more information. Because as human beings, if we give someone silence, we naturally want to fill that gap. We want to fill that void with words. And as a practitioner, it's your role, your responsibility to not be the one that is filling that void. You want the patient to fill that void with more information in the information gathering stage of the consultation. So an example of a nice open question. So tell me what brings you here today. And you've spent quite a bit of time formulating that nice open question, which is fantastic, so it's usually very effective. But you find then your patient gives you quite a short response. So I've been getting headaches over the past few weeks. Now, in response to that, think about where you go next. What would that next open question look like? So you might be inclined to say, oh, how many weeks? And of course what you've done there is you've immediately narrowed it down, and we're focusing on one element. You think about that content page, we're focusing only on one element now of that content, which is the duration. Okay, so we've captured virtually nothing on that page of content, and we're already going in with quite a narrow question. So what we actually want is silence. Okay, so you say, tell me what brings you here today, and they say, I've been getting headaches over the past few weeks. You don't say a word. You just nod, use encouraging hand gestures, lean forward. If you still get nothing, then you might want to say, well, okay, tell me a bit more about the headaches. Nice. We have still narrowed it a bit, but we know that it's headaches. We need to find out more about headaches, but we've still got a fairly open question. Conversely, you want to avoid something like, okay, well, how do they feel? We've closed it down again. So tell me more about the headaches. Depending on how they respond, you want another open question, not closed. Think about that first page of content. How much of that do I have? And you should get the vast majority of that from the first 60 seconds of the patient talking. So in addition to using these open questions, lots of silence, you clearly need to manage your time. And the way you do that is providing some structure through signposting and reflective listening and summarising. Now there is a separate short video about signposting and reflective listening, so please watch that next. In terms of summarising, that's a really good diagnostic indicator of whether or not you are using open questions. If you find that you're transitioning from information gathering to information giving, and you have not yet found the need to summarise, it means that you have not been using open questions. You've clearly been having open and closed questions, so rapid conversational turn taking, which has meant the patient has not had their 60 seconds, and there has been no reason for you to have to summarise what they've said and put it in any sort of order, because the order is being imposed by you asking lots of closed questions. Okay, so this is so this absence of summary before you move to information giving is a really good indicator that you need to rethink your consultation behaviours, and you need to introduce more closed questions. So as I said, please now go on to watch the videos on signposting and reflective listening.